the session today. So a few announcements. One, as you saw, we have Walt Dannenberg presenting on October 22nd. Very excited about that presentation. He spoke at last year's Lean conference about psychological safety, and it was a powerful presentation. So I encourage everyone to be there October 22nd, same time, same place on Zoom. Also, we are accepting submissions for the annual publication award. I'll be posting the link in the chat later during the presentation today. So please submit your manuscripts that were accepted or published within fiscal year 24. So September 1, 23 to October 31st, 24. Oh, my volume is low. I'm sorry. Thank you, Selena. I will speak louder then. Is this better, Selena? Okay, fabulous. So please submit your manuscripts. And if you didn't hear the first part, join us October 22nd for Walt Dannenberg. But on to the main event. So Cassie Bragdon and myself will be reporting on our efforts related to PCORI HSII. We'll get into what PCORI HSII is again. But we are part of the Evaluation Sciences Unit, who is a mixed methods group, so qualitative and quantitative researchers, working to improve healthcare delivery across the whole system of Stanford medicine. So if you have a project or question or anything, please reach out. We're always interested in collaborating on evaluations and helping teams determine how best to evaluate and design their projects, even very practical quality improvement projects we can help you with. And my background in particular is quantitative science, as I mentioned, with expertise in community nutrition, and I've done a lot with telemedicine. Cassie Bragdon is a qualitative researcher and project manager within our unit, and really loves projects related to human technology interaction and user experience and clinician facing systems. But our group has many interests, and I guarantee there's someone that would be interested in your project if you are looking for help. Next slide. For the PCORI HSII effort, we wanted to shout out our great undergraduate student, Sajida, who has been helping us build this website. Sajida is within engineering right now, has a couple different majors related to biomedical engineering, but is also interested in how best to communicate science to the world. So we felt like she was a perfect match for helping us build the PCORI HSII Toolkit as well as the SMCI website. Next slide, please. So going to go through, I'm going to start with a few introductions of like who everyone is in this project team and how everything is layered together. And we're going to be asking a few questions throughout this presentation that we would love for you to either respond in chat or get off mute and tell us your thoughts. So this is just background to begin thinking about some of the questions we have. So you're here at the SMCI lecture series today. And just a quick reminder that Stanford Medicine Center for Improvement is a Stanford Medicine entity. So we're really looking to unite all entities under the Stanford Medicine umbrella. And we really want to be the best at getting better. Our focus to do that, to be the best at getting better, is to foster education and capability development in improvement science, and enhance evaluation, publication, and external funding of improvement projects, amongst other activities that fall underneath that scope. Our director is Dr. Terry Plachek, and our executive administrator is Lisa Freeman. Okay, so with this PCORI HSII is being housed under SMCI. Since PCORI HSII or PCORI Health Systems Implementation Initiative really wants to target both adult and children's health, but also academic and our academic partner clinics. So we thought it'd be best to have it housed under SMCI to really have the reach to all entities under Stanford Medicine and beyond. PCORI HSII is a multi-year initiative with 42 healthcare systems. These healthcare systems are immensely diverse, where there's many academic systems within PCORI HSII, but there are also non-academic healthcare systems that span multiple states with thousands of clinics, as well as even smaller systems than our own. The goal of this initiative is to advance the uptake of clinical effectiveness research into clinical practice. So what that means is PCORI has funded a lot of work that has shown that interventions can work in various settings. However, the translation of that late stage research to actual practice as it had a lot of government support, and this is where PCORI wanted to close that gap. So really encouraging healthcare systems across the US to look at these clinical practices, figure out how to implement them in their setting, and then report out with evaluations of what happened. And then across all 42 healthcare systems, hopefully we can get a lot of learnings to see how we can support the further spread of these practices. And then we're eligible for these grants I'll talk about in a bit. Currently, PCORI HSII is co-PI'd by Dr. Paul Maggio and Dr. Grace Lee, with tons of support from Lisa Freeman and team. Next slide. So again, I mentioned that there's opportunities to spread these projects, and PCORI is just finished up the second round of requests for applications. And what we've seen so far is that there are two mechanisms to get funding. One is implementation projects, and this is $500K to $3 million over 4-ish years, and pilot projects that are shorter, I believe 1 to 2 years at $200,000 for the total cost. And there are selected topics that PCORI wants health systems to improve. So the next spring RFA is spring 2025. I'm thinking earlier in the spring, so maybe February, March, something will be released. We will be announcing it here in the newsletter and on the website. But potential topics include intensive lifestyle treatment for weight loss in primary care settings, addressing hypertension in adults, monitoring electronic patient reported outcomes during cancer treatment. And I've heard PCORI say they're trying to select a few other topics to be included in the next RFA. If you know anyone who would be interested in any of these topics, please reach out to either Kim Stern or put your interest in the chat, and we will make sure that you are on the listserv to get announcements from Kim regarding when things are announced. Great. And then round one. So again, I mentioned PCORI just got done with round 3. That round 1, we were successful in getting the funding for an antimicrobial stewardship program Dr. Hayden Schwenk and team submitted a great application looking to spread antimicrobial stewardship program to Packard Children's Health Alliance, and also the PEDS ED, which is actually under SHC's scope. So we are very excited. We think this is like the first big grant that overlaps both Children's Health, SHC, and PCHA. And I see Brittany Reynolds, your question in the chat is great. I do not know I can't recall if adult the hypertension includes gestational hypertension or not. We will get back to you on that. But again, back to this. Thank you so much there's several people on this team that supported this grant. And we're excited to have Hayden and his team speak in early 2025 of these efforts regarding the stewardship program in the pediatric setting. Next slide. Okay, so this is one point of we want your feedback. So we've described SMCI, PCORI HSII, some of the potential topic areas, but we really want to hear from you, either in the chat or off mute. Oh, I lost the questions, Cassie. PCORI HSII is just one grant-funded activities that is being kind of housed under SMCI. And we would really like to know what is the best way to engage you or alert you for these grant-funded activities that are coming from SMCI. And how can we best keep you up to date? As you saw, the PCORI is ongoing. So there's going to be many calls throughout the next few years for these PCORI opportunities. So how do you want to know about them? And also the PCORI HSII has a learning collaborative that's one based on general, like how do you implement best practices into care, but also is developing topic specific learning collaboratives. So please, if anyone has any ideas about how we can get this information to you better, I see a few people putting information in chat, but if someone wants to also come off mute and talk about their experience, please feel free to do so.
Hey, Sam, this is Ndidi.
Yes.
One thought, I think while I'm relatively new here, we get a lot of different emails with different funding announcements from different sources. And I wonder if there's an opportunity to consolidate that such that people know, okay, when I get this email, I know I can go and see all of the funding announcements that might be relevant to my work, instead of having to miss out because you're not paying close attention to all of the different emails that you're getting. So that's just one idea.
Great, thank you. Yeah, I wish that existed too. We will have to think about how SMCI can maybe join up with some other teams sending out these announcements. Any other comments before we move to our next part of our presentation?
And Carlos put a great comment in the chat. So he said the Youth Teams channel, SHC Connect website, and distribution list sign up. And Carlos, I'm wondering if you're able to pop off mute or put it in the chat which distribution lists you're specifically looking at, if you don't mind sharing.
Yeah, happy to. I was wondering if they're just like different categories for district. I'm not familiar with which ones currently exist, but if there was like a proactive way to sign up and say like, hey, I want to continue to get more information, and you just submit your email, and it could be by topic. Like, I only want funding announcements. I want details on everything going on with this program. Not sure what already exists.
That's a great question. And currently we have two mechanisms, which may not be getting to everyone. First is becoming a member of SMCI and getting the newsletters. These announcements will be in the newsletters, but also understanding that we get a lot of newsletters here at Stanford, so you might skip some. And then two is we have had within the newsletters and our presentations here reaching out to Kim Stern. But I hear that there may need to be another mechanism or maybe a more publicly available mechanism on the website to get on Kim Stearns, who is the administrative support for PCORI HSII, and get on her listserv for these announcements. We'll definitely provide the feedback to the group. Okay, great. Well, if anyone else has any suggestions, please feel free to put them in the chat and we'll move on to our next phase of this. So the next phase, I'll put Cassie will cover most of it, but we really wanted to give you also an update of, we got this capacity building grant through PCORI HSII, and we wanted to give an update of like, what have we been doing for the past almost year and a half now. This grant ends at the end of this calendar year, so we're all wrapping up now. So the goal of our capacity building project was to support the timely response to these RFAs and provide supports for the implementation efforts. So the goal one was to establish infrastructure to enable coordination, collaboration, and oversight of these activities. And this was primarily based in forming two committees, the steering committee and the management committee. Goal two is to develop a toolkit of implementation and evaluation tools that can be used by all teams across Stanford Medicine, and as you will hear, will be publicly available to anyone in the world. And the ESU is leading the plan to execute the toolkit. So the goal one, we have had the executive management team meeting monthly since June 2023, and the folks on that team are listed there. These folks are really helping coordinate the efforts and process all this information coming in from PCORI HSII and figuring out how we can align it with SMCI and all the clinical organizations underneath Stanford Medicine. And the advisory board and steering committee has also been established. As you'll see, a ton of our C-suite members are represented on this list, as well as folks from the School of Medicine for the more academic side. We also have various external and actually external to Stanford, and as well as folks who are at Stanford University do work semi-related to SMCI, but provide additional perspective with a slight outside expertise. Next slide, please. Okay, and the toolkit. So we've met with many folks on this call today, but want to give an update of where we're at. So we have gone through a multi-stage process of inventory tools, going on a listening tour and hearing what you need for implementation and improvement tools, summarizing the toolkit, and then designing a toolkit with a web designer, as well as getting feedback from various groups across SMCI and Stanford Medicine. Right now, we are refining the toolkit based on user feedback. and are probably going to meet with a few more of the folks on this call in the next month. But I want to hand it over to Cassie at this point, because we are wanting to describe today how we did this, but also get some more feedback from you all on how we can further improve the SMCI website and toolkit.
Thank you, Sam. So as Sam mentioned, I'm going to walk you through our steps so far. So starting from last summer and then looking forward to the website launch. So our first step, phase 1, was an inventory of all the existing quality improvement resources, courses, videos that exist already throughout the Stanford enterprise, and really making sure that we knew who all the key players were, what tools are being used by different teams at Stanford, and making sure that we would be able to integrate them into the toolkit so that nobody was left behind. So we began our inventory by making a list of about 25 groups who were identified by our prior work, as well as connections that were made by SMCI and leadership. So specifically Lisa Freeman and Grace Lee, who were aware of some other groups that Sam and I weren't necessarily aware of at the beginning. We conducted about 30 to 45-minute meetings with the groups that were identified. We gave a short presentation, very similar to what you just heard from Sam, about the PCORI HSII initiative, what that is, what that means for Stanford. We talked specifically about the capacity building initiative. Why are we creating this toolkit in the first place, basically? And then we made our request for resources. So resources here is quite broadly defined. So tools, templates, videos, even people within the Stanford system that people go to for guidance. We really wanted to know what people were doing in their quality improvement processes along the way. And then once we had identified those resources, we used Notion, which is an online kind of project management platform, to build out a pretty complex project management site. We call it the Toolkit backend, where resources can be organized by program, by material type, and by project stage. So that was the first step in our process. And in the end, we met with 14 groups across the Stanford enterprise, so meaning School of Medicine, Children's Health, Stanford Healthcare, and we collected approximately 220 resources and identified 8 courses for inclusion in the toolkit originally. So those all went into our toolkit backend. And once we had an idea about what the landscape looks like at Stanford, we decided to go on a listening tour. So the point with the listening tour is really to make sure that this toolkit that we're building is really addressing the needs of the Stanford quality improvers. We wanted to make sure that we were getting a wide variety of responses and making sure that, again, everybody's voices was heard. So to that end, we followed up with some participants from phase 1 and then kind of broadened our range to include clinicians, operations, and administrators who, again, were identified through this new initiative, making connections through SMCI and this new PCORI HSII funded work, and then as well as prior connections that we did know about. So we developed a topic guide to orient these conversations around tools and resources. So we always made sure to ask what resources and tools people are using, just in case we missed something during the inventory stage. We were constantly adding things to the toolkit throughout the listening tour if we identified tools that hadn't been added in previously, but that groups really used, valued, or had created. We also talked about people's quality improvement processes, how they think about their process, you know, where do they start? Who do they go to if they have a roadblock? What challenges do they face? And then we shifted gears a little bit to talk about the design of this new toolkit. So we talked about website design. We talked about, you know, what kind of pages would you like to see? What kind of resources would you like to see? And then we also talked about organization of these tools. So that's really getting back to that project stage framework, where We're trying to organize things on the toolkit in a way that makes sense to the most amount of people so that people can go on the website, they can click around and pretty intuitively understand what tools will live where in which section of the toolkit. And overall, these meetings range from about 3 to 10 participants. We did conduct them on Zoom. So if there was a larger number of participants, greater than 5, we broke out into breakout rooms for discussion, just again to make sure that everybody had a chance to be heard. Let's go to the next slide if it wants to go. Okay. So in the end, we conducted 9 listening tour sessions with 46 participants. And our major learnings included that participants recognized that the problem stage is the most important, yet often the most overlooked. So you can assume you know what the problem is, but unless you dive deeper, perhaps you're addressing a surface level problem and there's something deeper going on. So they wanted guidance from the toolkit to help them dig deep to understand the problem better. Participants indicated a need for guidance on where to start, especially for those new to quality improvement. So really what we learned from that is that the toolkit needs to be beginner friendly. We need to make sure that if you're totally new to quality improvement and you don't really know what any of these terms are, that you're able to hop on and figure it out within the toolkit. Participants also really highlighted that the toolkit needs to be flexible to meet the needs of different individuals and groups throughout Stanford. So again, we're talking about this huge enterprise, different sites, different operations, different frontline staff situations. So we just want to make sure that the toolkit is accessible for everyone and can be used by everyone. And then finally, and this wasn't really within the scope of this particular project, but we think it's important to highlight that participants really wanted a repository of previous QI projects in order to understand what projects had already been done, what the learnings were, and also to potentially connect with those individuals, those like-minded individuals, to perhaps create a new QI project building on that. So we have, we've done the inventory, we've done the listening tour, we've gotten some preliminary ideas for the website, and now we're taking those ideas over to our website designer. And before I get into the details of this, I just want to give you an overview of what the timeline looks like for this phase 4. So phase 4 was really the longest so far. So our listening tour wrapped up last fall. I believe it was November or so that we finished up with the listening tour. So we synthesized that information in December, and then in January, we really hit the ground running by starting the initial website design and build. Once we had a working work in progress website, we started uploading content so that as we were building things, as we were going around to different groups, getting feedback, we would have, a more finished looking website to get people's feedback on. And then once we had that initial website, we started to do some kind of feedback session light with some poster presentations. And I'll talk a little bit more about what that actually looks like in practice a little bit later on in this presentation. So we did 2 of these poster presentations in May and 1 in September at the Lean conference that just wrapped up. And then in September, ongoing, we started doing more specific feedback sessions with particular groups and individuals to make sure, again, now that we have this pretty close to finished website, we have all the pieces in place, we hope, we want to make sure actually that we're not missing anything and making sure that what we built does address the needs of the community. And then looking forward in November and December, we're going to launch the website and then start advertising it widely. And part of that advertisement includes Sam doing a great panel presentation at the upcoming Academy Health Dissemination and Implementation Conference in December. So to back up a second to January, that's when we really started this website development project. So we identified that we really needed to revamp the whole SMCI website in addition to building this new toolkit. And the reason for that is that for our scope, that toolkit is living within SMCI. So we want to make sure that people are able to navigate to that toolkit quickly, easily, and that they know that it exists. So we started doing some consultations with Lauren Fulton Design, who's our web developer for this, web designer. And those consultations included Sam, myself, Lisa Freeman, and a few others who I think are on this call, Ryan, who were able to hop on and talk about what the SMCI website needed to do, what it needed to look like, and then also building out that toolkit based on the feedback from the listening tour. And then we also started initiating these feedback sessions. As I mentioned, those started this spring with the poster sessions. But before I go into the specific activities that we have been doing, I want to just say a little note about co-design, which is a collaborative method where end users and stakeholders work together alongside designers and researchers to design a product. So our scope, unfortunately, wasn't wide enough for us to do true co-design, but we thought it was really important that we did get end user input all throughout this process. So as you have heard already, and what you're going to hear again, is that we've really been going back to these end users, these groups throughout Stanford who will be using this toolkit in order to really inform that design and functionality throughout all the different phases of the build and development. And then based on all of this feedback that we've gotten, we've iterated website design between sessions. So I mentioned previously that our first poster session was in May. We made some changes. We presented again in September, made some changes. And then throughout all the feedback sessions, we're also hearing what groups have to say, and then we'll move forward with iteration based on that as well. So I just wanted to throw in that little note about co-design, because you'll see with our posters that they were really focused on co-design because we left a lot of it blank, actually. So you can see there's some gray squares here, which are thankfully filled up with Post-it notes. But when we showed up to these conferences, those were blank. And really the idea here was that we're standing around, we're going to talk about what this toolkit is, but we really want to hear people's feedback. We want to make sure that we're not missing anything. Again, a lot of the people at these conferences or symposiums are not people that we perhaps had a chance to speak to during our listening tour. So we wanted to make sure that they were being heard throughout the process. So as you can see, we had Post-it notes that they were given, and they were able to add their thoughts directly on this poster. And we were able to integrate that into the feedback and the iteration of the website. And I will say that this was a fun little change from the normal poster sessions that we've done before. I'll note that on the left, we had some additional handouts that we tried to use. We tried to give people a copy of the abstract, and we tried kind of a whiteboard method so people could draw on printouts of the actual draft website. But people didn't interact with that quite so much. So you can see in the second version that we really streamlined it. We really just had those Post-it notes. And if you did come by and give us a Post-it at any point during the poster sessions, I just want to thank you again for helping us out there. And another way to provide feedback, so as I mentioned, we are conducting feedback sessions with groups and individuals throughout Stanford. So now that we have the draft website, we're able to screen share that. We can walk through it. We're using kind of an adapted think aloud process where I'll slowly scroll through a page and people can, verbalize their thoughts, point out anything that stands out to them, identify if anything is missing. And then we also ask some additional probes, what do you think about this page? What do you expect to see on this page? And then how do you expect to navigate throughout this? Again, just to make sure that the content and the usability of this website is really where we need it to be. And those feedback sessions so far have been about 30 to 45 minutes. And again, we're going pretty wide with who we're bringing this in front of. So a few quality improvement groups, again, a few people on this call, a few stakeholder groups, and then some groups, very excitingly, who we identified during the previous either listening tour or poster sessions. We were thankfully able to reconnect with some folks there. And as of right now, we've spoken to approximately 50 people. in a few groups, and we're continuing to schedule throughout the fall as we make iterations prior to launch. And before I get into, some of the changes that we've made to the website, what it looks like now, I want to just highlight a few of the major learnings from our feedback sessions and poster sessions so far. So similar to what we heard in the listening tour, maybe participants desired a beginner's guide to orient to the toolkit and identify commonly used tools, templates, and resources. So our thought there is that we'll create a page that kind of walks you through all the different terms that are used in the website, and then have a carousel that walks you through all the different commonly used sources. And then participants also thought that tools should be organized by audience as well as by project stage and material type. So originally we only had material type and project stage to filter through. You could select, I'm working on how to identify the problem, and then you would see all the resources listed there that would help you out with that process. But now we've added additional filters. So you can search for Stanford healthcare, you can search for beginner, you can search for Stanford children's health, things like that. So we're really trying to make sure that different communities that are coming here are able to find the resources that they need. We also heard that courses really need to be displayed in the top navigation bar instead of hidden within the toolkit. So we have made that change as well. Frontline participants highlighted that the site must work on mobile as well as desktop to address the accessibility needs of staff and clinicians, especially frontline staff and clinicians who are in the clinic, busy. Maybe they're doing this really quickly during their lunch hour. They want to find a specific tool. We just need to make sure that the website works well for them if they're using a smartphone or a tablet or something like that. And then also we heard that search and filtering functionality was really essential. So I just want to briefly show you what the current state of the SMCI website is, and then briefly show you what the future state will look like. So this is SMCI as it exists today. You can see that there's a lot of different tabs up at the top. There's some drop-down menus. There's kind of a lot going on. And getting back to the beginning of this presentation, talking about the toolkit living here, we knew that we had to make it a streamlined process to access the toolkit just to make sure that people wouldn't overlook it. Again, getting back to that, people are busy. They really want to quickly find the resources that they need. So based on people's great feedback so far, this is the draft of the future website. So you can see we've simplified the top navigation bar. And apologies if it's a little bit small and you're not able to see it quite well. In the future, it will, when it is launched, it will make sure it's sized for your screen, but this is just a screenshot for right now. You can see that we have the SMCI tagline, becoming the best at getting better. And then we have a direct link straight to the toolkit right from here. You can see, again, we heard from people that we needed a search functionality, so we've added a search function prominently here, as well as within the toolkit, there's some filtering functionality, and you can see we can access courses as well here. So I just wanted to tease you a little bit with what the future SMCI and toolkit website will look like as I wrap up my portion of the presentation. So I just want to say quickly thank you to everyone that we've spoken to. Again, I know a few of you are on the call. We so appreciate all the feedback and advice and guidance that we've gotten from everyone throughout this process. And I also have a request for additional feedback. So as Sam mentioned, the idea today is really to make this a bit of a conversation. So you've already given a few of you some great thoughts on our previous questions, but we'd love to continue to get your thoughts just to make sure, again, that we are making this as usable as possible for people, that people know where to access it, and all that other good stuff. So just like before, if you want to unmute and start the conversation, or if you'd like to type in the chat, we'd love your feedback on these questions. So I'll just read them out quickly first. So how do you use the current SMCI website? How can we best advertise the new website? And this may get back to those great points about teams and different distribution lists that Carlos brought up earlier, but we'd welcome any additional feedback there. What groups would SMCI and the new Toolkit website be beneficial to? What can SMCI do to better support your quality improvement work? And then what else would help support your quality improvement work? Again, just identifying if there's any gaps in our draft of the website. We want to make sure that we have resources for all of you. So I'd love to hear your thoughts. And again, feel free to come off mute, feel free to jump in, or also put them in the chat. Thank you so much. Thank you, Terry. Again, the executive director of SMCI, putting in the chat, he often uses the website for information about upcoming programs. So that's a really important function. So we have added a scroll bar at the top of the new SMCI website that will list all upcoming events and also anything else that we want to highlight. So thank you for sharing that. Anyone else have any thoughts about any of these questions? And I'll also put them in the chat just if you want to reply directly there as well. And a great point from Hazel as well. So mention SMCI during new employee orientation and new leader onboarding. And Hazel, I don't know if you're able to come off mute or if you're able to add some context to your comment in the chat, but I'm just wondering, are you suggesting that they do that in the future and how might that look? Or is that something maybe your new hiring experienced that? I'm just curious your perspective.
Yeah, I think just, I know sometimes it gets overwhelming during new employee orientation or new leader onboarding, but sometimes if you hear it and then down the line, say in a few weeks, you happen to think about performance improvement or initiating a new project, and then it will recall your memory. It's like, oh, there is this resource available, and then it will kind of just trigger your memory. I know that's how it works for me. And but yeah, I've actually started doing it. So I'm from SMP and I have the quality team, and this is some of the resources that I direct them to during onboarding.
Awesome. Yeah, thank you for sharing that. So kind of like getting an earworm in there, right? If you mention it during onboarding, even if it's overwhelming, at a future point, you'll be like, oh, I know what that is. I know that that's a resource for me. So that's great. Thank you so much for sharing that, Hazel. And I see that there's a hand raised. Would you like to come off mute?
Sure, this is Cheyenne, also from Stanford Medicine Partners, and I just so happen to be on the team that does new employee orientation for all of our new employees. I present for our diversity, equity, and inclusion team, and I think including this as part of that work introduction could be supportive to Hazel's efforts. And then again, I think repetition is always great. So if I promote to the NEO team, promoting this to our new employees, and then when they hear it from Hazel, then it's a second time and it can start to feel less intimidating as a new resource. So I appreciate you, Hazel, for lifting that up, and I will take that to the team.
Awesome. We love when connections happen. All right. Yes, Sam just put in the chat that we'll be in touch, and definitely we will follow up. We want to make sure that SMP voices are also heard in this. Really hopeful that it will be helpful to you all, the toolkit and all the other great resources that SMCI offers. And I'm seeing that there's some comments in the chat. So let's see. Olga says, I refer back to the lecture series and sometimes send links to my coworkers and customers. So that's great. So making sure that that lecture series is still accessible on the new website, which it will be. Let's see. And then a comment from Nahom, I hope I'm pronouncing that correctly. The SMCI website will be a great resource to their quality improvement projects. And we really hope that it is. That's really the driving force behind this project. So thank you so much for joining us today. And any other thoughts or comments on the questions we put in the chat, or any other questions you might have for us as well? We want to open up the floor to make sure that any of your questions are answered as well.
Yes, I have a follow-up question on our earlier answer from Carlos, I believe. With connecting SMCI website, which is outside of SharePoint, with SharePoint at SHC, SMCH, etc., are there particular pages on the SharePoint that anyone on this group feels like SMCI should be linked on, so you could go there and link out to SMCI? Well, if anyone thinks of any, or if you are an administrator of the SharePoint website where you feel like maybe a link to SMCI could be helpful for your staff, please reach out to Cassie. Her email is on the slide. We have 1 minute left because I want to give everyone enough time to transition to their 1 o'clock, but any last comments? Oh, thank you, Salome. At the bottom of the intranet, within resources, we will look into that and figure out how to integrate this into there. But thank you all. It's 12:50, so we'll end here, but we appreciate the participation. Please reach out regarding the website or PCORI HSII, and Cassie and I can try to get you in touch with the right people. But thank you all for your participation, and I hope to see you October 22nd at noon for our next presentation. Have a good rest of your day. And yes, the presentation will be available on SMCI's current website and the future website.